I'm Dr. Dudley. Fever is a common reason parents bring their children to the office or call us overnight. While fevers might seem frightening, they actually mean that the body's immune system is gearing up to fight off infection. 98.6 degrees is a normal body temperature. A fever is defined as a rectal temperature over 100.4 degrees. For infants, the gold standard is the rectal temperature. In children over age 2, it's also okay to take the temperature under the arm or tongue. Parents often ask, what's too high? I usually tell them that our body's thermostat generally stops around 105 degrees, so it would be unusual to exceed that. Many parents worry that a fever will cause a seizure, but those only occur in about 2 to 4% of the population, so no matter how high the temperature, most kids will not have a seizure. While there are exceptions, fevers are usually caused by viruses or bacteria. It takes time for other symptoms to develop, so unless your child is under 2 months old, immunocompromised, unvaccinated, or looks really sick, having them seen in the first few hours of a fever might not be helpful. If your baby is under 2 months old and has a rectal temperature over 100.4, you'll be referred to the ER for further workup. If they're older than 2 months but still young, please call us and we'll discuss the next steps. You don't have to give medicine if your child has a fever but is otherwise okay. If they're uncomfortable, we recommend acetaminophen for infants over 2 months old and or ibuprofen in infants over 6 months. Never give a baby under 2 months of age any medication without checking with us first, and please remember that aspirin is never used in children unless directed by a cardiologist. Fever-reducing medicine will only lower a temperature by about 2 degrees, so please don't stress if a fever doesn't go away after medicine has been given. How your child looks when they're sick is the most important thing. If you're worried, call us. Every child handles fever very differently, and much depends on the duration of their illness and on concurrent symptoms. Thank you for listening and for trusting us to care for the most precious people in your lives, your children.